If you've watched my past videos on retinoids, then you must already know all its anti-aging properties and benefits on the skin, and you're probably excited to try it if you haven't already done so. But what if you can't tolerate it? Is there an alternative? Or maybe you're just curious to know if there's anything that comes close to this very powerful anti-aging ingredient. Hi guys! I am Dr. Gaile Robredo-Vitas, your board-certified dermatologist on YouTube. I try my best to post one video a week all about the correct information on skin and skincare. And I'm also on Instagram as @IreneGaile, where I post similar content about the skin. Let's start this video with a brief recap of what retinoids can do before I move on and talk about alternative ingredients that can do or have similar mechanism of actions as retinoids. Retinoids are a big family of vitamin A derived compounds and substances, still arguably the gold standard in anti-aging. They are anti-inflammatories and antioxidants that, number one, regulate skin turnover o yung pagpalit ng balat natin, thereby fading pigmentation, improving tone and texture, and brightens dull skin. Number two, it stimulates collagen remodeling, increases elasticity, and reduces the appearance of fine lines, wrinkles, and even improves stretch marks. And three, it controls oil production. That's why it's very helpful in those with oily and acne-prone skin because it helps unclog the pores, preventing breakouts. And for retinoids to be able to do all of these, they have to be used continuously and consistently for at least 6 months. However, in higher concentrations, or even in some individuals using lower concentrations, retinoids can cause peeling, irritation, and redness. And they are also not recommended for use by pregnant and lactating women. Thus, an alternative or alternatives are sometimes required. First would be your alpha-hydroxy acids, which exfoliate the skin, stimulate collagen production, and improve pigmentation. AHAs are water-soluble acids derived from sugarcane, milk, almonds, or grapes. So, yung mga examples mo would be your glycolic, your lactic, your citric acid. They work by breaking the bonds that hold skin cells together, sloughing off dead skin cells to reveal new, younger-looking skin. They are indicated for those who have fine lines and wrinkles and even pigmentation, or dun sa mga gusto lang na may glow and laging young-looking yung skin nila. Number two would be your beta-hydroxy acids, which also exfoliate the skin, but in addition, controls oil production. So unlike your AHAs, your BHAs are oil-loving, and they are able to penetrate deep into your pore and dissolves keratin plugs and sebum, and this is how they control oil production. BHAs also have anti-inflammatory and antibacterial properties, making them ideal dun sa mga individuals with oily and acne-prone skin. The most popular BHA that you can find in the market would be your salicylic acid, but there are also others like your willow bark extract and your Salix alba. Third alternative ingredient would be your vitamin C or your ascorbic acid, which is also considered a pro-collagen that fades pigmentation and brightens dull skin. Vitamin C is a potent antioxidant which neutralizes free radicals, protects our skin from oxidative stress, and aids in repair and regeneration of damaged skin cells while also providing photoprotection. It also decreases melanin production and fades dark spots without altering your skin color, and is essential in collagen formation, improving firmness and elasticity. This is why vitamin C is actually one of my favorite ingredients. I don't even use it as an alternative. Ginagamit ko siya in the morning, even if I'm already using retinoids in the evening. Before I go to my fourth alternative ingredient, if you guys are enjoying this, if you're getting a lot of good information, please show your appreciation by hitting the like button or subscribing to my channel. I promise to continue to make informative and hopefully helpful videos for you in the future. Thank you! Number 4 in my list of alternatives are peptides, which are short-chain amino acids, the building blocks that make up our keratin, our collagen, and elastin. Peptides make our skin, hair, and nails smooth, strong, and resilient. So without them, you would probably see a lot of fine lines, brittle nails, and even dry and fragile hair. They send instructions to our skin cells to make new collagen and elastin, or to hydrate the skin, or to repair damaged skin cells. Common examples of peptides that you may find in your skincare products include your argireline, your copper peptides, your matrixyl 3000, your palmitoyl tripeptides, and your tetrapeptides. And last but not the least retinoid alternative, number 5, is Bakuchiol. So, I'll be honest, I've never really tried it. I've read so much about it, but it's not that easy to find here in the Philippines. So, di ko pa siyang tatry. It is said to be a less potent but a very promising and is sometimes considered by others as the closest alternative to retinoids. Bakuchiol, I hope I'm saying it right, is an anti-inflammatory and antioxidant extract from the leaves and seeds of the babchi plant native to India and Sri Lanka. It has long been used in Chinese and Ayurvedic medicine for wound healing and has been shown to do similar things like your retinoids. It increases cell turnover, it stimulates collagen and elastin production, and can also regulate melanin synthesis. According to a study published in the British Journal of Dermatology, using Bakuchiol twice a day is comparable to using retinol once a day with the same concentration. In addition, because it is an anti-inflammatory, it is much less irritating than your retinoids, and it can also be used by pregnant or lactating women. But before coming to the conclusion that retinoids are not good for your skin, and bago kayo lumabas dyan at bumili ng mga retinoid alternatives, I think it's very important to ask yourself first these questions. Did I start with low concentration retinoic acid like 0.025% or low concentration retinol like 0.25%? Did I start with less frequent application like using it once or twice a week first and then every other day before I started using it every day? Did I use it with other possibly irritating ingredients or too many ingredients right away? When starting on retinoids, we dermatologists recommend starting with the lowest concentration possible, with less frequent applications, and doing techniques like applying a moisturizer before or after your retinoid, or doing the sandwich technique wherein you put your retinoid in between two moisturizers, which will reduce irritancy and can make it more tolerable for you. Also, I advise to maybe temporarily discontinue using your other irritating actives like your acids when introducing your retinoids. And since you're using it every other night or twice a week, maybe on those days that you try it, don't na muna apply your other ingredients that are irritating. Remember that reactions vary per individual and it's really different. Meron mga iba dyan na they were able to adjust right away. They don't even experience peeling or redness. Whereas meron naman mga iba na even with the lowest concentration, nakaka-experience pa rin sila ng mga irritation, redness, and peeling. And that's okay. However, if you're not sure, it is still best to consult an expert like your board-certified dermatologist. So those are the 5 alternatives that I recommend if you can't tolerate retinoids. I would really love to know about your experience, especially with Bakuchiol, because I've never tried it and I'm actually curious to try it. Please don't hesitate to put all of them in the comments below. So that's it, guys. Thank you for watching and I will see you again soon. Take care always and stay safe.